Good afternoon and welcome to the National Parkinson Foundation's webinar series. Thank you for joining us today. My name is Adolfo Diaz, Director of Patient Services. I will be your moderator this afternoon for our webinar. Before we get started, I'd like to review a few logistical details with everyone. The presentation will be lasting approximately 45 minutes, followed by a question and answer period. You can submit your questions online at any time during the presentation by typing in the box you'll see on the bottom left-hand side of your screen. We will try to answer as many questions as possible, and please try to keep them on today's topic. The presentation in its entirety, both audio and video, is being recorded and will be available for viewing as an archive in approximately 1 week. All registered users will receive an email as soon as it is posted. If you experience any technical difficulties or lose your connection, try to refresh your browser first and exit and log back in. You can also contact technical support at 651-225-1532, 651-225-1532. Today's webinar is titled Balancing Act, Falls Prevention in Parkinson's Disease. Our speaker this afternoon is Dr. Bas Bloem, Medical Director of the Parkinson Center in Nijmegen, Netherlands, a National Parkinson Foundation Center of Excellence. He's also the Director of My Healthcare Network and a Professor of Movement Disorders at the Radboud University's Department of Neurology. Dr. Bloem is also the director and founder of Parkinson's Net, which is a network of regional care communities in the Netherlands of healthcare professionals specialized in treating individuals and families affected by Parkinson's disease. Dr. Bloem is a world-renowned researcher and has been widely published on various topics in Parkinson's disease. He is also the principal investigator of the ParkFit trial, which I believe he will be sharing a little bit about with us later in the presentation. And in 2011, he was named National Care Hero and Nijmegen Citizen of the Year in the Netherlands. And needless to say, Dr. Bloem is also flush with enthusiasm and excitement now that the Netherlands has beaten Spain in the World Cup. We were actually quite surprised he joined us and was still not celebrating. With that, we pass it along to Dr. Bloem. Thank you, Dr. Bloem.
Well, thank you for the introduction, Adolfo. I cannot tell you how much pleased I am to be sharing some of my knowledge about falls in Parkinson's disease with you folks. I know if you ask people with Parkinson's and their family what is one of the most important things, and oftentimes people will say it is falls. And the common question in my office is, what can I do to prevent falls? So in my presentation, I will highlight the importance and also address a number of ways that can be used to hopefully reduce or perhaps even prevent falls altogether. Before doing so, I would like to, let's see, can I advance the slide? There we go. Whenever you see this, this take-home basket, there will be a message for you to reassure you that this is important information that I hope you will remember and can take home with you, or take it to the office and see your physician or physiotherapist and discuss the items with them. Let's start first with a few windmills. I'm sure most of you are familiar with the famous book about Don Quixote, the Spanish soldier long time ago who was fighting imaginary windmills. And oftentimes when I speak to patients, or even when I speak to colleagues, there are many misunderstandings about falls in people with Parkinson's disease. And I will discuss all of these quote-unquote windmills with you in my presentation. The first misunderstanding is that falls are not really important. I think the very opposite is true, as we will see in a minute, and I think most of you will be aware of. The second misunderstanding is that falls typically have one cause, and that if you remove that single cause, the falls will go away. And that's not true. Most often falls have multiple causes, which means that you have to work very carefully with your physician, with your physiotherapist, with other people involved to do a complete workup. It's oftentimes a combination of medication, the environment, the disease itself. A host of factors contribute, but we will come to that later in the course of my presentation. The third misunderstanding is that falls are mainly a motor problem. What I mean to say by a motor problem is that it is mainly caused by the slowness or by the stiffness. And of course, slowness contributes, there's no doubt. The stiffness also contributes to falls. Again, there's no doubt. But I will emphasize that a difficulty, for example, to do multitasking, which is more of a thinking or a cognitive problem, is also a crucial element of the falling problem. So it is both the mental aspects, fear, orientation, maybe even memory, as well as the motor problems that work together in producing falls. And obviously, in treating falls, you need to tackle both. And finally, there's a widespread misunderstanding among medical personnel that falls cannot be prevented. Now, my main goal for today is not to give you a rosy or shiny perspective on falls, which is not true. Of course, falls are a difficult problem, but I think it is a misunderstanding to think that they cannot, at least to some extent, be prevented. And the most important things that you can look after will be in this presentation. So, item number one, windmill number one, why falls are so important. What you can see here is a scientific graph. It looks a little bit like a bell shape. On the x-axis, horizontally, you can see the so-called UPDRS score. So people on the left, close to zero, have very early Parkinson's disease, and folks on the right have very advanced late-stage Parkinson's disease. And you can see that, of course, early on in the course of the disease, there are no falls. And as the disease progresses and Parkinson's becomes more severe, falls start to increase and become more common. But lo and behold, what you can see is that as the disease progresses even further, as we move on to the right side of the curve, falls go down. And of course, this is not because we are curing the disease, but this is because some people become so afraid to walk that they simply sit down in a chair or in a wheelchair. And of course, once you sit down for the rest of the day, you will no longer fall. So I think the fact that falls become less common in advanced stages of Parkinson's disease is not a good sign. It's a sign that patients may have become very afraid to move, and this is something we should address. So here's a very important message for you, and which is that the best predictor of falls is a prior fall. So whenever you experience your very first fall as part of your Parkinson's, this is certainly something not to be ignored, but something to be discussed, again, with your physician or maybe the physiotherapist, because it may be a sign that your balance is not as good as it used to be, and it needs to be looked after. But as you can see on the slide, falls in fact predict a lot more. Falls also predict injuries, and this is the reason why it is so crucial to look at, in fact, at the first fall, even if no injury has occurred, because you want to prevent future injuries. On the left, you can see a broken hip, which, as you know, is a major concern, because once you break your hip, it is oftentimes a reason to become more dependent on advanced care. And on the right, you can see the white part in the side of the skull. That's a hematoma, a hemorrhage, caused by a fall on the head. And obviously, these are things we very much wish and hope to prevent altogether. what is really an under-recognized, but in our research a very common consequence of falling, is a fear of future falls. I'm sure most of you will recognize the feeling when you see this particular sign, be aware, a slippery surface ahead. Immediately you will adjust your gait, your walking pattern. You will adopt a more broad-based gait. You will start to move more slowly, or perhaps if you're wise, you may want to avoid this surface altogether. So the fear of falling is in fact a very common feature in people with Parkinson's disease, and we now know that some people are so fearful that they stop moving altogether. And of course, this is something that must be prevented at all costs, because if you stop moving, your physical fitness will go down, and this is really not a good idea. So a fear is something also to be discussed. And here you can see it. Apologize for this slide if I say that this is your average American. It might as well be the average Dutch person, although, as Adolfo was pointing out, they are now cheering and rooting for the Dutch national soccer team. But as you can see here is lying down on the couch may prevent falls, but you can easily imagine how this will have many, many other adverse consequences. A fat tummy is the least of your concerns. People who do not move enough lose their physical fitness. It's bad for your heart. It's bad for the bones. It's bad for everything. In fact, there is now evidence it may worsen your Parkinson's symptoms. So we've seen that. So fewer falls is not necessarily better. And that is an important message. As the disease progresses and if falls go away, there's two options. Maybe a physician did a heck of a job and treated your balance. But certainly, if falls are going away because people become less active, that is not a good solution. This is why, together with the National Parkinson Foundation, and also sponsored by the Michael J. Fox Foundation, we did a study which was called the ParkFit trial. And the ParkFit trial was essentially a study that was aiming to get people off the couch and get them into motion. But, and this is important, in a safe way. Because if your balance is not perfect, you still need to move, but you need to move in a safe way. And that's why physical therapists and who act as a coach are important. And in fact, our ParkFit trial was very much a coaching study. I decided to throw in a little bit of football, soccer, as you say in the United States. This is our head coach, Louis van Gaal, and he's doing the high five with Van Persie, who, for those of you who have seen the Dutch soccer team in action last week, scored the magical first goal against Spain, giving great joy to the country. But just as much as every sportsman needs a coach, I think every patient deserves a coach. A coach to tell you how to move in a safe way so that you prevent falls, yet remain physically active at the same time. Just because I'm so proud, I threw in this little slide for two reasons. One, because the goal scored by Van Persie, wearing his orange cape here, was truly a magically beautiful example of Dutch skills. But it's also a slide to remind you that falls is really something seen in active people. So if you simply promote physical activity, if you just tell Parkinson patients, go out and about without addressing safety, you might actually see that falls start to increase. So yes, people need to move, but you need to move in a safe fashion. And that's why you need a physical therapist to look at your individual abilities and capabilities to design a program that allows you to move, but it allows you to move in a safe fashion. For example, I'm personally a great fan of a home trainer because you cannot fall off the home trainer. You can put it right in front of the television and maybe watch a good game of basketball or something else that you like. Keep it entertaining so that you can adhere to your training program. But find an exercise program that is tailored to your individual abilities. And this is my final soccer slide. I promise I won't show you any more soccer slides. I just loved it because, Spain beat us in the finals 4 years ago, and this was our big revenge. But I promise to stop from showing soccer slides from here on. My serious take-home message is, make sure that you find a personal coach to help you remain safely active. Those two words, safely active, is critical. Active for the heart, for the bones, for the muscles, and also even to suppress the symptoms of Parkinson's safely in order to prevent falls. What about types of falls? This is important because I strongly believe that if you as a patient recognize the type of falls, you can inform your physician in a much better way so that the treatment can be tailored accordingly. Oftentimes the physician is in the dark. What is the cause of the falls? And this is why I'm sharing this information with you. There's always, cowboy movies. Cowboy movies are easy because you can separate the world into guys with black hats and the white hats. And it's no different for falls, although these two guys both look very friendly and nice to me, I have to say. But it is critical to distinguish between falls that are preceded by a loss of consciousness versus the falls where you are fully conscious of what was going on. And the reason why the distinction is so important, the one on the left, caused by loss of consciousness, has a complete different etiology, it's a different cause, and it requires a totally different treatment, as opposed to the one on the right, where you remain fully intact, consciously intact. In this paper that you can see in this slide, we presented a few useful tips and tricks that you may also use for yourself to decide which one of the two falls types you had. If your fall was caused by a loss of consciousness, syncope as it is called, oftentimes patients do not remember the moment when their body hit the floor. They more or less find themselves back on the floor, but don't remember the moment when they contacted the floor. So if that is the case, it may well be that you experienced a very brief loss of consciousness. And again, this is a blood pressure problem, which can also occur in Parkinson's disease, but it requires a very different treatment from the other types of falls. Conversely, if you do remember, the moment when you hit the floor, that means probably your consciousness was intact, and it's the other fall type. The other useful feature is asking about the nature of the injuries. If you are fully conscious at the time of the fall, what happens is, and it's almost inevitable, you stretch out the arm to protect yourself from being injured. And if you fall on the outstretched arm, you will injure your wrist, maybe the collarbone. Whereas if you are unconscious at the time of the fall, you may fall flat on the head. So the type of injury tells you a little bit about whether or not you were consciously aware just prior to the fall. And again, wrist injuries, shoulder injuries are usually a sign that you were conscious at the time. And again, that is important information for your physician when he's trying to treat your balance and prevent falls. And this is another very important message. I see many of my patients in my clinic, and they tell me, well, doc, I fell more or less spontaneously. And I'm quite certain that many of you folks on the other end of the line must have experienced the same thing. You know, you really don't know what happened, but there you go and you fall. And I can tell you from my own clinical experience, which I have to say is quite rich in this area, as well as our research, shows that if you think the fall was spontaneous, there are two big options. One is you may have lost consciousness just very briefly, even though you are not even aware of it yourself. But even if your loss of consciousness is very brief, it can be enough to cause a fall. And the other big category is freezing of gait. And I will show that to you in a video in a minute. Freezing of gait is this mysterious phenomenon where the feet suddenly get stuck to the floor and you're unable, as if, invisible glue or a magnet is drawing your feet towards the floor. Your trunk is moving, you cannot lift the feet, and there you go. And oftentimes, these freezing events can be so brief that the patient is not always fully aware of it. But if a physician hears about spontaneous falls, he should know that freezing of gait could be one of the causes. And freezing, as we will see later on, is a treatable symptom. Here is the video, which is not running on my screen, but I hope it's running at your end, of a patient. Or should I advance to the next slide? Is it running at your end?
It's not running.
Okay. Shall we just advance to the next slide? I guess so. That's all right. There it is. Now I can see it. Here you can see this gentleman walking, and suddenly the feet get stuck, and you see this typical high-frequency movements. So I think what you could see very nicely in the video is this freezing is a very dynamic feature. Many people think freezing is being totally stuck without any movements, but in fact freezing is causing these typical trembling movements of the legs. The patient experienced the feeling of being glued to the floor, and importantly, as you could very nicely see in this video, freezing is sometimes there and sometimes it isn't. And that is the very reason, what you can see in this present slide, why it is such an important cause of falls. If freezing was there all the time, you could at least anticipate. But because this symptom is oftentimes absent and suddenly it reappears, it catches you by surprise and causes a fall. It's a treatable symptom, and that's why it's important to recognize this. So, falls in Parkinson's disease is oftentimes, not always, but it is oftentimes freezing. A number of studies have now shown it to be the leading cause of falls in Parkinson's disease. And again, I cannot emphasize this enough. Freezing, although it may be difficult, is a treatable symptom, at least to some extent. And here's another important message for you, which is also an important message for physicians, I guess. But if you as a patient and as a family member, as a spouse or a child, if you remember these rules of thumb, it will help you to put the physician on the right track. And freezing of gait is something to be considered when patients fall forward, because walking, many people don't realize that, but walking is actually moving your trunk forward and then quickly putting your feet beneath the. So when you do this and your trunk is moving, you fall forward. The other trick, as I pointed out before, if patients suspect it's a spontaneous fall, oftentimes it will in fact be freezing of gait. And the other very important reason when people freeze is while turning around, particularly turning around in tight quarters. You're in a cramped space, you need to turn around, that is a notorious reason for producing freezing. And as you turn around and the feet get stuck, you fall sideways and you fall onto the hip. So that is a risky situation which may lead to a hip fracture. So an important trick to prevent these falls is in fact making wider turns. Try to avoid making tight turns whenever you can. Try to make a wide turn. So now we're coming to the causes of falls. We've talked about freezing, we've talked about a loss of consciousness as two important causes. Oftentimes, as I pointed out in the beginning, it is a combination of factors. 1 and 1 adds up to being 3. One thing is something patients oftentimes can deal with. As soon as a second factor arises, then the patient is in trouble. And in this cartoon, I will highlight the various causes of falls. The first one being age-related factors. For example, muscle weakness. And weakness is something that can be trained with a good physiotherapist. Intoxications. Alcohol is an important one. I'm not saying you folks should never drink any alcohol anymore. In fact, I recommend my patients to take 1 or 2 alcoholic beverages simply because it's healthy and enjoyable. But try to avoid extra high doses of alcohol because it slows your reaction times. And adverse effects of treatment. For example, as we will see in a minute, sleep medications may help you to put you to sleep, but oftentimes the effect still carries on during the day. It slows your reaction times even further, and we now know this is an important extra risk for falls. It's avoidable, so that's certainly something to be very critical about if you're taking sleeping pills. Here's just a little cartoon as a little diversion. This is a bar I found in Glasgow in Scotland. And I said, well, if your gait is so impaired by alcohol, you start to walk like a cannon, then definitely you're in trouble. So that type of alcohol intoxication is certainly to be avoided. Pills is an important one. A number of studies, many studies have shown that the more drugs you take, and particularly drugs that affect your consciousness, is a risk factor for falls. So I'm not talking about the Parkinson medication. I'm talking about, for example, sleep medications or anti-anxiety medications. It's a class of drugs called benzodiazepines. Valium is one, as an example, which are a notorious cause of falls. And it makes the risk of falling worse even if you already have Parkinson's disease. So what you're seeing here is a little scientific graph. The risk of falling is higher in people with Parkinson's disease, but folks in gray have Parkinson's, and you see the folks in the red bar who have Parkinson's and are taking these benzodiazepines have a 5 times higher risk of falling. So that again is an avoidable thing. Particularly if you realize that taking sleeping pills every day is going to, in fact, worsen your sleep after about 6 weeks of continuous use. So if you are on a benzodiazepine, discuss its use critically with your physician. If you are on multiple benzodiazepines, which is not rare, you certainly have to discuss it with your physician. The second main group is, of course, disease-related factors. We've talked a little bit about freezing of gait, but as you know, and many of you will have experienced this, oftentimes Parkinson's is not your only disease. You may have joint problems, You may have sensory problems because there is diabetes. We know now that if you are reaching the age of 70, in the Western world, most people have 3-4 chronic diseases. And this starts to add up. So if you fall, my message here is don't just blame Parkinson's disease, but make sure you have a complete workup so that the joints are okay, your diabetes is treated well, and all other factors are looked after. Don't attribute everything to just Parkinson's disease. And don't forget muscle weakness. Now, these are muscles shown in this little cartoon. A number of studies have now shown that probably because Parkinson patients are not as active anymore, they develop secondary weakness. And weakness, muscle strength, is something that can be trained. If your muscles are weak, stair climbing becomes more difficult, rising from a chair becomes more difficult, getting out of bed becomes more difficult. And again, it's a treatable condition. So speak about this with your physician or physiotherapist. So this is an important message. The factors that I discussed so far are all related to the patient. This is what is called intrinsic falls. And most falls in Parkinson's disease are not related to the environment per se, but they are related to factors related to you as a patient. So if you want to avoid falls, it pays off to look after yourself rather than to look at the environment. We will come to the environment in a minute. I'm not saying it's unimportant, but the majority of falls are related to factors that happen in yourself. And we've discussed a number of them already. I already mentioned briefly the influence of cognition, thinking, and one important item, which I will show here in this little video, is the risk of multitasking. It's quite a funny video because it's a lady who's walking in a shopping mall while she's sending a text message on her mobile phone. And I'll just let the video speak for itself. There, I think you could nicely see this lady who fell into the water because she was paying attention to the phone rather than to the quality of her gait. I know it's a funny video, but there is a serious message here, namely that multitasking, doing many things at the same time, is oftentimes related to falling. And in fact, one of the most influential papers in the field of falling has been this little paper here, which was published in the journal The Lancet, where these researchers demonstrated that if a person is no longer able to simply walk and talk at the same time, that was a very reliable predictor of falls in elderly people. And in fact, this is even worse in people with Parkinson's disease, because the part of the brain that's affected by Parkinson's disease is precisely the area that you need for a multitasking. And this is a little cartoon, a graph to show that many falls in Parkinson's disease, that's the blue bar compared to the red bar, are related to multitasking. So in real life, many patients experience falls when they're doing many things at the same time. So here you can see this donkey floating in the air because apparently the guy who was owning this little truck was overloading. And this cartoon is just a funny little thing to remind you that doing too many things at the same time is not a good idea. So here's again a take-home message. Falls in Parkinson's patients are oftentimes related to multitask circumstances. Walking and talking, walking and paying attention to something else, walking and carrying something in the arms, and avoiding dual tasking, splitting things up in sequential order, is a potentially trainable thing that can be trained with a good physiotherapist. We talked a little bit about the environment. I already said the main problem is in the patient, but there are factors in the environment: poor lighting, loose rugs on the floor, a slippery floor. So these factors are obviously important, and they should be addressed. But again, the bulk of the problem is in the patient and not in the environment. Just to remind you that this is an incredible result, which actually comes from my own country. Do you know what is the most common environmental hazard in Holland? Lo and behold, research has shown it is in fact the cat. Because these cats, friendly and lovely as they may be, wander around the house. They lie down on different positions all the time, so you cannot anticipate. And in elderly people in Holland, the cat was the most common cause of falls. I'm not telling you to get rid of your cat. I'm just telling you to be aware if you have a cat. Make sure that you know where the cat is when you're wandering around the house. And finally, and this is equally important, there are, of course, protective factors, strategies adopted by the patient or the family to try and prevent falls. For example, compensation. In fact, walking more slowly is a wise thing if your balance is not secure. The use of walking aids is important. And I'm just showing you here in a little cartoon why compensation is so important. What you see in any patient with a chronic disease like Parkinson's disease is I think is the net balance between what the disease is doing to you plus what you as a patient or the family try to make of it. So physicians like myself are trying to fight the disease with medication, surgery, physiotherapy perhaps, but I think in particular physiotherapists, but also occupational therapists, are the ones that are able to exploit compensation strategies. And that is equally important. Training ways to overcome the disease in a different way. And what I mean by this, I will show here as a beautiful example in this video here. It's a patient of mine with Parkinson's disease who was unable to walk because of freezing of gait. And who was still able to ride his bicycle. This was actually a famous patient. He was front page news in the New York Times. He was shown on CNN, on BBC World. And it just shows you the remarkable ability of people with Parkinson's disease to fight and combat their disease. And here is the original paper that was published in the New England Journal of Medicine. On the left, in the photograph, you can see this man barely being able to walk. And on the right, you can see him cycling, apparently without any problem. And we now know that this is in fact a very common feature in people with Parkinson's disease. And of course, this can be used to fight the immobility and the lack of activity in people with Parkinson's. And if riding a real bicycle is too dangerous or too difficult, then please use a stationary bicycle, a home trainer. So the final few minutes, I will talk about prevention of falls. In the course of the presentation, I've already mentioned a number of things you can do and that you should pay attention to, but here's a number of extra tricks. You may recognize, this is from a famous movie with Tom Cruise. I'm showing the cartoon to illustrate that many physicians think that treating falls is a mission impossible. And I hope that you will conclude at the end of my presentation that this is not the case. One example of what can be done is medication. And I'm not sure if this video will run properly. Let's see what the next slide is doing. No, that's all right. So there are many symptoms, including freezing of gait, which can improve with dopaminergic medication, in particular levodopa. Not rarely, the physician is happy with the effects of the medication because your upper body seems to be well controlled. As it turns out, for many patients, you need higher doses to treat the lower body, to treat the legs, to treat the freezing. So if the hand function is fine, you may still need a higher dose to treat the legs. And of course, the freezing of gait is leading to falls. So that is an important thing to recognize. And when you think about the effects of medication, it is very important for you as a patient to distinguish between falls that happen when your symptoms of Parkinson's are very pronounced. This is called the off state, when the medication effects have worn off, versus falls that occur in the on state, because this requires a very different treatment. Falls that happen when your Parkinson's is bad, when there's lots of tremor, when there's lots of freezing, when you are slow and stiff, will oftentimes at least get partially better by increasing the medication. But some patients, it's a minority, but some patients actually experience more falls as the doctor tries to push the medication. That's the red circle. These are people who feel well controlled, but experience the falls. Not rarely, the useful trick is to ask yourself, how is my walking early in the morning before I take my medication? If your gait, if your walking actually gets worse after the morning medication, you may want to be one of those rare people who have on-state falls, the red circle, and that's something to be discussed with your physician. Unfortunately, and we have to be honest about this, particularly in later stages of the disease, there are falls that are resistant to the medication. But here, the physiotherapist or the occupational therapist can still give you benefit. What about deep brain surgery? Deep brain surgery, which you can see in this cartoon, is an effective treatment for people with Parkinson's disease, but you need to select the right patients. Those symptoms that do not improve with medication will also not improve with the surgery. So don't put false hopes into the surgery if the medication isn't doing the right thing. Surgery is a good option for people who do experience good responses to treatment, but the good episodes have become more and more rare and are dominated by off symptoms. But if you have no longer good on symptoms on medication, the surgery is not a good idea. And this is just a little cartoon of a patient before and after surgery, in fact with the stimulator switched on and off, and I will let the video play in a minute. And you can clearly see the difference between the left and the right. But of course, it is very important to carefully select the right candidates for the surgery treatment. The man that you saw in the video also responded to medication, and that's why he was selected to have the surgery in the brain. Now here you can see this little cartoon, which I personally really love. You can see the left front wheel is missing, but this farmer is using his wife as a counterweight on the other side. It's a hilarious cartoon, I think, but it also has a serious message, and that's the reason I'm showing it. The reason I'm showing it is the disease, the missing wheel, is not cured, but by compensating, the tractor can still move forward. And this is in fact exactly what physiotherapists are doing. They're not curing Parkinson's disease, they're offering compensation so you can still move. And here's one example of what cueing can do. Cueing is an external trigger to facilitate movements. And you can already see in the still presented in this slide, on the right hand side there's a little red tape pasted in the doorway. And I will play the video now so you can see the effect. So I think that is quite convincing evidence that, for example, putting a tape on the floor is an important treatment used by a knowledgeable and experienced physiotherapist. And this is now part of guidelines. My center in Nijmegen has developed guidelines which are available in English, and we work in fact with the National Parkinson Foundation in bringing these guidelines to the United States as well. Good therapists know about these strategies, which can be used in addition to medication, in addition to surgery, to help you. And in closing, I just want to here say that each treatment should always be individually tailored. It's not a one-size-fits-all. So there are generic problems, like the sleeping pills, the benzodiazepines, which should be reduced or stopped whenever this is possible. But there are also other generic problems, such as weakness. In fact, this is not related to Parkinson's disease itself, it's just related to the inactivity. And here the intervention is exercise and strength training. Other people may have freezing of gait. And as I pointed out here, medication is important. And other folks may respond to the cueing strategies, the tape put on the floor. Not everybody requires every treatment. It's an individually tailored approach. And in our Dutch Parkinsonet, which is a Dutch invention, we have a national network of people, of therapists, about 3,000 therapists, who have been trained to deliver these physiotherapy interventions at a high end in the people's home. And the good news is that we are about to sign a contract to now start bringing these concepts to the United States. And we will, of course, team up with the National Parkinson Foundation, who is our lead partner in the States, in making sure that as soon as possible, such strategies will be made available to people in the United States as well. here is a study we did to evaluate the effects of these cueing strategies that I just showed in the video. And what is quite remarkable, you can see this here in this scientific cartoon, the dark green bar is people receiving expert physiotherapy as part of our Parkinson net, as opposed to folks receiving regular care by an inexperienced therapist. And you can see that in Holland, the number of hip fractures has gone down quite remarkably. Broken hips. So these treatments are really very effective. So my main take-home message is that falls are not untreatable. Again, I'm not trying to depict a rosy image here that cannot be made true, but I think you are hopefully convinced that by a careful individual workup, looking carefully at what is causing falls in your specific case, and with an expert physician, an expert therapist, falls can be treated. And the practical points that I hope that you will take home with you is find an expert who understands Parkinson's disease, who understands falls, to look after you. Work up your individual set of causes of falls. Optimize the medication. More levodopa for freezing, less benzodiazepines. Sometimes brain surgery, if you are the right candidate. I'm a believer in physiotherapy, and I think you should nearly always have a good therapist doing gait and balance training. And I think oftentimes an occupational therapist who goes to your home, removes the hazards in the home, the loose rugs on the floor, better lighting, is also very helpful. And in closing, I want to thank the NPF for the invitation, and you folks at home in the United States for your attention. Thank you so much.
Thank you very much, Dr. Bloom. And with that, we will move on to some of our questions. We have several. Our first question, Dr. Bloom, I've heard there is a difference if you fall forward or if you fall backward. Is there any difference, and does it mean anything?
That's a very good question. Yes, it could mean something. Falling forward, as I pointed out, is oftentimes freezing of gait. And freezing is something that can be treated, for example, with a tape on the floor or levodopa. Falling backward is more likely to be a balance problem. Falling backward, if it happens very early on in the course of the disease, could in fact be a sign that you're not dealing with Parkinson's disease, but with a different condition called PSP, progressive supranuclear palsy. Backward falls in general are more difficult to treat than forward falls. One helpful trick, if you fall regularly backward, is to use shoes with slightly higher heels. So to shift your balance just a little bit forward. Side effect may, of course, be more forward falls. So don't try this yourself at home, but do this in a discussion with your physiotherapist.
Dr. Bloom, can wearing weights on your back help prevent falls and improve gait? I've seen several products online.
I've heard the stories, but I must say that this is not an evidence-based treatment. So I do not recommend this myself as a treatment. There is no good research to show any benefits, and in fact, the evidence that I know is pointing in the other direction, is putting people on a treadmill with a harness and actually lifting the body a little bit to alleviate the pressure on the feet. Because there is some reason to believe part of the walking problem is shifting from one leg to the other, and by increasing weights, you may actually worsen the problem. So I do not recommend this as a treatment, in all fairness.
Dr. Bloom, is it common at all to have frequent falls very early in the disease? I fall at least 4 times a month.
Well, it depends on how you define early on in the course of the disease. It is an important question. The rule of thumb is, and this will be part of the new international criteria for Parkinson's disease. I'm actually part of a task force who developed the guidelines for the new criteria, is regular falls in the first 3 years of Parkinson's disease is very uncommon. So if you have regular falls, and 4 times a month is very regular, that is unlikely to be Parkinson's disease, the pure disease, and it is more likely to be one of the forms of atypical Parkinsonism, such as PSP or MSA, multiple system atrophy. It's hard to say from here which one it is, but if you experience regular falls in the beginning of the disease, it is a good reason to go back to your neurologist and discuss whether the diagnosis is truly correct.
Dr. Bloom, are there any particular balance training exercises that should be practiced every day by Parkinson's patients as a rule?
Yeah, I think there are evidence-based strategies to train balance and gait. And without going into full detail, these are part of the international guidelines, which are available in English. I'm sure we can distribute these, or I hope at least, through Adolfo Diaz and the other people at the NPF. One training that is now evidence-based is, for example, Tai Chi, which I guess many people can learn from a therapist and then train themselves. I think a good therapist teaches the patient what they can do themselves every day. So the answer is yes. If you want to know the specific strategies, please resort to your therapist and listen to the evidence laid down in the physiotherapy guidelines.
Dr. Bloom, is it typical in Parkinson's patients when walking on a downward slope to suddenly pick up speed and feel like they're unable to stop?
Yeah, that's a very good point. Yes, this is a well-known feature in people with Parkinson's disease. What this patient is describing is called fascination, and it's probably a combination of a balance problem, but particularly the difficulty of many patients to take larger strides. If you go down a slope, and if you're healthy, you subconsciously increase your stride length. You take longer steps. This is a difficult problem for people with Parkinson's. So ramps, slopes should be avoided if you can.
Dr. Bloom, I already have DBS surgery. Can the settings on my stimulator be affecting my balance and causing falls?
Yeah, again, that's a very good question. There are a number of reasons why this may have developed. It could be that this is just a coincidence, and that because Parkinson's with time got worse and now is producing some gait and balance problems. But we know that there is a proportion of people where, in fact, for some reasons that we don't fully understand, the DBS may actually worsen the gait and balance problems. The good news is that using a particular set of strategies, changing the stimulation settings, you can get it a little bit better. In particular, restoring the symmetry between the left part of the brain and the right part of the brain, assuming that you will have bilateral electrodes. Toying with the voltage, toying with the stimulation frequency can also sometimes help to improve the gait and balance problems. So this is definitely something to discuss with the neurologist looking after your stimulation settings. It's a very technical thing, and you need to understand your stuff. So if your neurologist is uncertain perhaps or lacks experience, then it may be wise to seek help from a real expert in that field.
Dr. Bloom, I'm able to stand straight for brief periods of time, but I can't seem to be able to sustain it. I feel like my back is not strong enough. Or could it be my legs?
It could be either one of the two, in fact. There are a number of people with Parkinson's, it's relatively rare, who have a particular problem in the legs of a tremor, which during prolonged standing causes a progressive feeling of instability. it's almost as if the legs grow numb. These people will typically experience an improvement as they start to move. It could also be weakness of the back muscles, either one of the two. Weakness of the back muscles is treatable with a therapist. If it's the tremor in the legs, what I oftentimes recommend to my patients is there are walking frames or just simply a cane with a little seat attached to it. And that's quite an elegant solution because you can, it's a high seat, if you will. You just put out the seat on your cane, and you can sit down and still engage in a conversation with other people standing upright. So that could be a helpful trick for you right there.
Dr. Bloom, my mother is one of those who suffers from frozen gait all the time and has had it for many months. You mentioned that it could be treated. Is it better to treat it through physical therapy or through medication?
I'm glad you asked this question. It's the combination of both. So I would not rely on just one or the other, but I would do both. The bulk of the freezing, the majority of freezing, improves with higher doses of levodopa. So the first thing to try is a higher doses of levodopa. At the same time, I would consult a physiotherapist and try the cueing strategies, the tapes on the floor, could be auditory cueing and metronome with a rhythmic beat, but you will need the combination of both, not just the one.
Dr. Bloom, I have low blood pressure. Consequently, I have fainted. Is there a non-medication way to increase blood pressure that you would suggest?
Yes, there is. So that's the first type of falls that I pointed out. That's the type of falls caused by loss of consciousness. It's the lowering blood pressure as you stand upright. There's a number of things that can be done. Adding extra salt to your diet is something you would intuitively try to avoid, but in your case, that is a good idea. Even if it goes at the expense of inducing a little bit of hypertension, high blood pressure, because you want to avoid the drop. So you want to have an extra high blood pressure by adding some extra salt to your food. The other thing to do is when you stand upright is move up and down on your toes, because what it does, it activates the muscle pump in your legs and it pumps up the blood towards your brain. So don't just stand passively upright, but use this pumping strategy. Lowering the head part of your bed also helps, because when you lie down flat in bed at night, you lose a lot of blood volume by peeing out volume with urine. So putting pieces of wood under the head part of your brain, so you lie a little bit upright, the heart must be higher than the feet, also helps.
And our final question.
Then you can use yeah. Go ahead.
Dr. Bloom, I have to use a walker all the time to maintain my balance. Would I still be a candidate or benefit from seeing a therapist or exercising? I feel like it's just too dangerous.
Sorry, can you repeat that question?
I am a patient who uses a walker all of the time.
Yeah.
In order to be able to maintain my balance, would I benefit from physical therapy, or is it just too dangerous?
No, I don't think physiotherapy is dangerous in your case. Of course, a good therapist finds a way to keep you active in a safe way. And obviously, if your balance is so compromised that you're dependent on the wall, then running around is obviously not a good choice. But still, there may be exercises to train your physical fitness and to keep you out and about in a safe way. So even in your case, I would warmly recommend to see an experienced therapist.
Bloom, thank you, and thank you to our audience. That is all the time we have today for questions. If you have additional questions that may not have been answered today, we encourage you to contact the National Parkinson Foundation's helpline at 1-800-473-4636, which spells 1-800-4PD-INFO, or you can send your questions by email as well to helpline@parkinson.org. Once again, we thank Dr. Bloom, and we encourage everyone to please join us on Thursday, August 14th for our next webinar on pain and fatigue in Parkinson's disease with Dr. Christopher Hess from the University of Florida. And remember that all of this presentation has been recorded in its entirety and will be available as an archive. Dr. Bloom, thank you once again.
You're more than welcome. I hope it was helpful.
Thank you. Good day.